Hello everyone. Welcome back to Meep Sciences channel after a long time. Happy New Year to 2024, and today we are going to discuss a very interesting topic on flesh-eating bacteria, a overview on guide to stay informed. It is a part of student mentorship program 2024. In this particular project, some of my BSc students are getting involved, especially Binderjeet and Afan. So let's get started with the glimpse of this entire presentation. What are the flesh-eating bacteria? The flesh-eating bacteria are mostly responsible for causing necrotizing fasciitis. This bacteria releases two types of toxins, endo and exotoxin, that destroy the living tissues. This particular regime of bacteria, they enters the body through the wound or broken skin. Once it gets into the bloodstream, it can gain access to multiple organs and may cause organ failure. Some well-known example of such kind of microbial regime is Streptococcus pyogenes and a type of bacteria named Vibrio vulnificus. Now the question comes, why is this important to know about it? The rapid and life-threatening course of flesh-eating bacteria infections necessitates early detection. Immediate medical attention is required for effective treatment and higher likelihood for the survival. It is very critical to raise the awareness since the necrotizing fasciitis has a higher fatality risk if not treated on time. Knowledge enables people to take preventive steps and measures that will allow to lower their chance of getting infected. Now, in a very nutshell, we need to know how these particular flesh-eating bacteria are getting transmitted. The necrotizing fasciitis NF is commonly transmitted through broken or the cut wound surface. Insect bites can also transmit NF agents, though infected needles that can also able to cause skin to get punctured. By consuming uncooked seafood or coming into contact with the seawater containing bacteria is an open wound. So this is a nice pictorial presentation which shows as a comparative overview between the infected tissue and a normal tissue. You can see on the left hand side, normal tissue, they are not showing any kind of activities or not showing any NF symptoms. On the right hand side, where it shows the mechanism how a necrotizing fasciitis has been occurred, and that can causes the deep spread of this particular microorganism and causes necrosis kind of symptoms and make abnormal texture of the normal tissue cells. It is very threatening that number of NF cases has been gradually towards the upright situation. The hospital admissions for necrotizing fasciitis has been increased from 9 to 16 per million people towards 2002 and 2017. Despite more admissions, death rate has been stayed the same. It suggests that the better treatment and early detection needs to be retained. Understanding, comprehension, this trend helps to ameliorate the healthcare strategies. Regular analysis, critical thinking, and proper guideline by the medical practitioner that will allow the progression in a proper handling of severe medical cases that are being caused by the necrotizing fasciitis, by this particular flesh-eating bacteria. There are certain taking precautions that would make our life more better, as prevention is always better than cure. It requires the prompt wound care. Immediately when you have infected or you are assuming you are getting infected, immediately clean and cover cuts or wound to prevent bacterial entry, the Vibrio species. Practice to have a good hygiene. Regular hand washing that will reduces and minimizes the risk of infection of transmission. Avoid contaminated water to get exposed to your body. Stay cautious in environment where bacteria thrive, like the warm seawater tubs. Swift medical attention. If you think that you got infected, your wound or your cut open area has been get exposed by this Vibrio species, flesh-eating bacteria, seek immediate medical help for any unusual skin alterations or past this pain. So how you can able to understand that you have been suffering or you have initiated the initial infection for necrotizing fasciitis? There are certain early symptoms that can be observed in the NF that can include a red, warm, and swollen area on the skin surface that spreads quickly, severe pain, including pain beyond the area of skin that is red, warm, and swollen, and you might feel some kind of mild fever. There are certain later symptoms which are severe of necrotizing fasciitis can also get included, like ulcer, blisters, or the black spot on the skin surface, alterations in the color of the skin surface, pus or oozing from infected area, drizzlingness, fatigue, tiredness, diarrhea, nausea. These are the very later common symptoms. So most attention needs to be taken care by the research institutions, research people to develop the new techniques that will allow the proper analysis, proper diagnosis, and proper medical precaution must be taken care to retain the public health when the people got infected by this flesh-eating bacterial Vibrio species. Improved diagnostic method needs to be attained. Early detection of NF is crucial for successful treatment. Researchers are working on developing a more sensitive and specific diagnostic test kits needs to be developed. New treatment approaches has to be established, like antimicrobial therapy, surgical debridement, and the hyperbaric oxygen therapy that is called HBO are being used to treat NF. Understanding the underlying mechanism of NF to understand what are the different checkpoints where you can apply different therapeutic means. Identifying bacterial virulence factors, host factors that can play a pivotal role in the development of NF. If you understand this mechanism, different checkpoints, different protein, and different molecules are getting involved in the NF mechanism, then it will allow us to understand and come up with new therapeutic means and different antibiotics that can easily reduce or eradicate the possibility of NF infection by flesh-eating bacteria. In conclusion, understanding, practicing swift wound care, the good hygiene, caution in certain environment are very crucial in preventing flesh-eating bacteria to get spread. Early detection, prompt medical attention are your best defense against this rare kind of serious threat. So these are the few references. If you're highly interested to go for a detailed study, what has already been done or what you could do it, you can go on through these particular further reading references. So thank you very much for your attention. And please keep subscribed and waiting for the next video, which will be more interesting for all of us. Thank you very much for listening. Bye-bye.